Let's talk dementia. So as a medical doctor, I can't comment on public figures, but I can certainly share everything I know about dementia with you. There are two main forms, Alzheimer's and vascular. Alzheimer's disease is something that's caused by plaques built of protein called amyloid and tau tangles. And so you can measure the protein in cerebrospinal fluid or through a spinal tap. And sometimes you can get an amyloid PET scan, which can actually detect the amyloid. But most brain scans will not detect Alzheimer's disease until it's at the really late stages when your brain has started to shrink. These proteins preferentially like to show up in the hippocampus, which is where we store memory. So it makes sense that one of the signs is memory loss. But you also get a loss of executive function, so making decisions, rational decisions. And at the very end, we might see things like delusions, paranoia, forgetting how to walk, talk, eat. All of that is stuff that we see at the very end. And it's super heartbreaking. The second cause of dementia that is most common is vascular dementia. And as you would imagine from the word, it's usually caused by strokes or mini strokes. So when the blood flow is compromised and the oxygen doesn't get to the brain, and those cells, they die off. And dementia is one of the components. So you would also potentially see other signs of stroke, like weakness in a leg or tingling or loss of speech or other kinds of stroke-like symptoms. There are two main tests that I studied. One is the Mini Mental Status Exam, or the MMSE, and the other one is the MoCA, or the Montreal Cognitive Assessment. You can find both of them online, but technically the MMSE family wants to charge you to use it, and the MoCA test wants you to do training before you can administer it. But let's be honest, they're both super easy, both to administer and to take. So once you've been diagnosed with Alzheimer's, the previous medications haven't been super effective at reversing it, but they have been slowing the progression. There is a brand new medication administered monthly through the IV. It was just approved this week, and they claim that it causes 22% less progression of disease, but what they can actually measure is that the plaques disappear. So this could be groundbreaking. With vascular dementia, it's all about controlling risk factors. So controlling hypertension, blood pressure, controlling diabetes, blood sugar, controlling cholesterol, stopping smoking. And for some folks who have like ischemic stroke or like buildup inside the artery, they might be prescribed a blood thinner like aspirin. Other things that we look at beyond the MMSE and the MoCA include an occupational therapy assessment, so to actually see what it looks like when you're functionally trying to do the things you're supposed to do in the day. Going to the bank, maneuvering your kitchen, mailing a letter, that's the kind of thing that they might assess. And then we always get collateral information from the people who see folks every day, like family, friends, caregivers, just to get their impression of how cognitive decline is going. All of these changes are way more prominent as people age, so it's quite rare, but it's not impossible to get dementia at a young age. Sadly, we're seeing a lot more of it with people who've had COVID infections, even the young ones. But statistically, somewhere between 20-25% of people over 80 will have some form of dementia, and this goes to at least a third of 90-year-olds. So yeah, I really think everyone should have annual cognitive assessments if they are doing any kind of job after the age of 75 that requires them to have memory and rational decision-making skills. I mean, we assess drivers after the age of 75. Why don't we assess other occupations?